Good evening. My name is Nam Pham, and my co-host is Ngọc Trâm. Welcome to VATV. As you know, VATV is sponsored by VATV, Vietnamese American Initiative for Development. We hope it will become a bridge for Vietnamese American and regular American, and for Vietnamese at different generation. This evening, we are very fortunate to have a very special guest, one of the leaders in Dorchester. And I would like to ask Trâm, our co-host, to introduce our wonderful guest.
Hi, Joel. So Joel is the Chief Executive Director of the Dorchester House Multi-Service Center since 1986. His career spans the private and public spheres, in which he concentrated primarily in community health and social services. And during his tenure as the Chief Executive Officer, Mr. Abrams has led the transformation of Dorchester House into a modern and sophisticated center of excellence for health and social services, while insisting on retaining the warm community culture that has defined its role in the life of Dorchester. And in his capacity as CEO, he co-founded DotWell, which is a partnership, which is in partnership with Codman Square Health Center, and that has emerged into a management and services to save money, build capacity, as well as make a deeper impact in the Dorchester community. And in addition to that, very busy man, he's also on the Boston Medical Center Board of Trustees, as well as president of the Center for Community Health Education, Research, and Service. So we welcome you today. How are you?
I'm great. How are you?
I'm good, thank you.
If I may, Joe, what is Dorchester House? I mean, we know what it is, but I think for many people, if you could.
Yep. Well, Dorchester House is a multi-service center, as its name implies, but it's drawn from the settlement house tradition, which really began around the turn of the 20th century, or I should say the 19th century, back in the 1890s. This is a movement that started in immigrant communities around Chicago and New York City and moved up to Boston, and provided services within the communities by people from the middle classes who settled in the communities, hence the settlement name. And Dorchester House was founded in 1887 and developed its health center in the 1960s. So it took quite a while till the health services came about. And with that, a new building was built. It's now our old new building, because we have since built new facilities. So it is really a combination of settlement house and health services organization, a very sort of complex array of services available to the community.
Yeah. You mentioned earlier that Dorchester House working with immigrants.
Right.
And I have been around in Dorchester for about 20, 30 years. So I guess over the past 20, 30 years, there have been a lot of refugees and immigrants from Vietnam and other communities resettled in Dorchester.
Yes. Interestingly, now, I've been at Dorchester House for 25 years, and when I arrived, the Fields Corner area of Dorchester, in which the neighborhood in which our organization is located, was comprised primarily of white working-class residents. You could see the beginning of the settlement of Vietnamese immigration there, and I could tell that this was going to be a growing population. And fairly soon after I arrived, we began to hire people from the Vietnamese community. We began to offer interpretation where we could, and also to write our literature and have signs and even our telephone messages in Vietnamese as well as English, and we added some other languages as well. But indeed, that population grew, and it is a major part of the Fields Corner community and is a major part of our patient population. I believe well over a third of our patients are now Vietnamese.
Wow. And with the influx of the Vietnamese population in Dorchester, and I know you mentioned you have translation services as well as literature in Vietnamese, but are there particular programs or anything that's tailored specifically to this community or the Vietnamese people in general?
We do try to keep our programs very diverse. We have occasional what we call multicultural events in which we celebrate the diversity of the Dorchester community, specifically our Fields Corner community, and specifically the community of Dorchester House. So we really have a wonderful mix of ethnic and cultural groups at Dorchester House. And when we do that, the Vietnamese staff and patients and consumers who are Vietnamese help us really to focus on the cultural celebration of the Vietnamese. We have some of our providers, some of our physicians, for example, are Vietnamese Americans.
Great.
And it is really important for us that they bring the information to not only the providers, but to the registration staff, to the frontline staff, to the administrators about the unique needs that come out of the Vietnamese American community. So we do focus on that and have celebrations whenever we can.
Yeah. This is a call-in show, so if for our viewer, if you have a question for Joe or for us regarding Dorchester House or healthcare reform, which we will talk about it, please call. The number is 617-708-3290. And again, the number to call in is 617-708-3290. Joe, healthcare, especially healthcare reform, has been a subject that we all talk about over the past couple of years. Has the healthcare reform in Massachusetts, and later on, I get almost now, the Obamacare, how will it, or how has it impact Dorchester House and its patients?
Okay, well, primarily it's been positive. The fact that more residents of Massachusetts are now insured by health insurance plans than ever in its history is a very good thing in general, and it's been very good for community health centers because health insurance generally provides a reliable form of reimbursement. Until health reform in Massachusetts came about, we had to depend on access to what was then known as the free care pool. It happened to be a reasonable source of funding for us, but I don't think it provided the kind of reliability that our patients needed, the kind of reliability that an insurance plan provides. And we're seeing more and more patients who are now truly insured, not patients who have to depend on our ability to extract payments from a source that is set aside by the legislature every year. Now, that doesn't mean that some of these insurance plans are not subsidized by the state. And when I say it's been good and bad, those subsidies are great because people can get insurance, but they don't necessarily pay us the costs of providing care. Many health centers who receive reimbursement from insurance plans, from Medicaid, from Medicare, get subsidized by large federal grants. And we indeed get some federal money, but even that isn't quite enough. So we're struggling a little bit with our reimbursement.
So have you taken advantage of the stimulus package that's been going on?
Yes, and so we're very fortunate in being what is called a federally qualified health center. While we don't receive a large grant from the federal government, it has opened up opportunities for us to access money available through the Bureau of Primary Health Care in Washington for various kinds of projects. One very substantial project is what they call a capital improvement program that has enabled us to expand our facilities, both our clinical and administrative facilities.
When will that facility be open?
Well, it's starting very, very soon. In fact, some of the new facility is open now. Yeah. We were able to expand our pharmacy, so we have a very comfortable and really a comprehensive pharmacy facility now. We will be opening shortly our urgent care / walk-in center. That's finished, and the Department of Public Health has reviewed that for its approval. So that is now pretty much available, and additional clinical space will be opening up. This is called the Doctor Will See You Now project, because what we're interested in is being able to accommodate patients when they need or want care, and whether that's through a walk-in service or through access to their own primary care provider.
Yeah. Talking about seeing patient, doctor seeing you now, in the past I could walk into a hospital, a clinic, Dorchester House, and say, oh, I'm sick, please help me. Right now with a lot of things change in healthcare services, can I still do that? Can I just walk to the Dorchester House, see the receptionist, say, oh, I don't feel well today?
In other words, has the budget costs affect your services in any way?
Our budget problems have not affected access to our services in general. Now, when I say in general, there are some services that we cannot provide and receive reimbursement through Medicaid, certain dental services, for example. And we probably should have mentioned all the different kinds of services we
please,
provide, which I'll get to.
I was just going to ask that.
I don't want to just throw out. We do so much. So, but in certain areas, it's more difficult to get reimbursed than in other areas.
Right.
And so we try to tailor our services to the reality of funding. And it doesn't mean we can't offer the services. It just means for some of our patients, we need to ask for funding out of pocket rather than being able to bill their insurance. But in answer to your question, the general principle is people receive care at Dorchester House irrespective of their ability to pay and irrespective of their coverage. And we are trying to provide that care when they need it. In other words, well, particularly if they're sick, we won't turn them away. If they're very, very sick, we may have to send them to an emergency room. But if we could take care of them, as we can for most of our patients, on site, we're committed to doing that. And with this new expansion, that's going to become a lot easier to accomplish.
So what are the services?
I'm glad you asked. Well, by and large, community health centers provide primary care. That's their major offering. So in pediatrics, internal medicine, family medicine, we do obstetrics and gynecology. We do certain kinds of specialty care, such as cardiology and gastroenterology, big words, that's the tummy. We offer oral health services, dental care, including periodontal care. Yep. We offer behavioral health and eye care. So those are big services. We have radiology, including mammography and regular x-ray, and we'll be installing digital equipment very soon, again, as part of this federal stimulus money. We have the pharmacy, we have laboratory, we have physical therapy. Then in addition to all of that, we have a swimming pool, we have a gym, we have teen services. So we're very comprehensive. And you mentioned Dotwell before. Yep. We do a lot of this in partnership with the Codman Square Health Center. And that has enabled us to offer services such as financial literacy, tax preparation, earned income tax clinics. And so it's quite an array of services. We are really there to provide the largest spectrum of services, because we understand that healthcare is not just what you get in a medical examining room by a physician. Healthcare is really the way you live your life, how you live at home, how you get educated, and the social determinants of health are as important to our community, to us,